Next, I'd like to welcome to the stage Dom and Liz, and they will be presenting the mental health graduate programs on behalf of Child and Adolescent Health Service, East Metro Health Service, North Metro Health Service, South Metro Health Service, and WA Country Health Service. Thank you, ladies.
Hello.
We can hear you.
Okay, cool. Hello, my name's Liz Cook. I'm a staff development nurse, but I'm also the coordinator for the transition to practice program at North Metro. And my colleague.
Good afternoon, my name is Dominique. I too am part of the staff development team, professional education training, mental health, North Metro Health Service. And welcome to this afternoon's session.
So we're going to talk a bit first about why you should come into mental health nursing, because it's absolutely brilliant and we need you. Sorry, can you you can see us. Okay, but first of all, I would like to acknowledge our acknowledgement of country. We acknowledge the Noongar people as the traditional owners and custodians of this land on which we work, and pay respects to the elders past and present. North Metro Health Service recognises, respects and values Aboriginal cultures as we walk in a new path together. Thank you. So we need mental health nurses. We are, over the next 5 years, fortunately, mental health services in Western Australia is expanding significantly, and we do need mental health nurses. It is a specialist area, but it is absolutely wonderful to be part of it. How common is mental illness? Unfortunately, it is more prevalent. You will probably know somebody who has a mental health issue. We used to be ranked 4th in the Australian burden of disease, but after COVID we are now 5th. So in the in what about 6 Australians, so that's 17%, will have experienced some sort of anxiety disorder, and 1 in 7 adolescents. So it affects not just this person, but also their life, their individuals, the families, communities, and also it causes significant economic and social cost to the nation. Okay, people with mental health issues are also more likely to develop physical illnesses, and they have a lower life expectancy, unfortunately, than the general population. So mental health is linked very, very closely to physical illness. We all suffer from some sort of anxiety and depression, stress. We've been stressed waiting to do this, so it's all linked, and these can lead to physical health problems, stroke, heart failure, etc. We've also trauma is a huge thing now, which can cause all sorts of physical health issues, which again can affect everybody within the family unit, and also, unfortunately, it comes down to money as well. So we want you to come into mental health nursing. It is difficult, it is frustrating, it is tiring, but it is an absolutely fantastic career to do. It's so varied. It offers us a unique opportunity to make a great difference in people's lives. We at North Metro as well, we as with all of the other health authorities, we use a holistic, person-centred approach. We care for patients and through the mental health crises, and we see them at their most vulnerable. And it's building the therapeutic relationships. It's working within the multidisciplinary team to help that person. And it is a wonderful, wonderful feeling when you can make some sort of headway with them. Obviously, we do it with mental health assessments and interventions. We also do mental health promotion and prevention. As a mental health nurse, you can make a real difference to the lives of those suffering from a mental illness. And seeing your patients overcome the barriers that they've had to face can be so rewarding. Okay. Right, we're going to do a it's very short video, okay, but it just gives you a little bit of insight into mental health nursing.
More than 1 in 5 Australians will suffer a mental illness that requires hospitalisation or community mental health service support in their lifetime. Over the last decade, the number of nurses working in the mental health sector has increased by 50%.
Mental health nursing is all about working in a multidisciplinary team. We've all got eclectic skills, and so a multidisciplinary team in providing a service for our patients. We've got ATT services, which is assessment treatment team, the home treatment team that we're going to be opening as well, but also we've got consultation liaison, where you actually work within the general hospital, working with the homeless, working with drug and alcohol services. So there's so many roads that you could take.
Working in mental health means working differently. Different places, different patients, and different solutions.
One that I'm doing at the moment with the police, we work an afternoon, and I'm driving around in an unmarked police car with a couple of officers, and we're attending all of the welfare calls, the mental health jobs that the police get called to.
In rural and remote settings, you often get a lack of general health services, a lack of allied health services, a lack of options of where to refer. So you get a huge, rich experience because there aren't so many services, and you get a wonderful opportunity to develop loads of skills that you wouldn't if you were in a metropolitan area.
Mental disorders can vary in severity and can be short-term or episodic, or persistent and requiring long-term healthcare solutions.
In postnatal mental health, we work with mothers who usually when they're pregnant, some moms go through postnatal depression, which can be psychosis. Being a first-time mom, it can be very frightening for them. We support them through that journey, stabilize their mental health so they can go back to normal functioning.
So a lot of people that come to the service have very poor physical health, and they're already attending a community outpatient service. And my role is to engage them in primary care through using a unique model of looking at their, being sensitive to their psychiatric concerns, as well as undertaking assessment, screening and care of their physical health.
Nursing in the mental health sector offers a unique opportunity to make a real difference to the outcomes of vulnerable people in our community.
The motivation for work is trying to make a change and make a positive difference to people's lives. It's more about sort of developing a relationship with patients and working out what their mental state is and what you need to do to keep them safe.
Every day you learn something new about somebody that you're going to work with.
Mental health is a growing sector in nursing, with vast career opportunities for nurses from all disciplines and levels.
I always say to students that come through, there's so many opportunities.
I completed my statewide graduate program here, and I loved it, and I just never left.
I did a comprehensive degree in nursing in New Zealand, and then chose to specialise in mental health and started a grad program there through the University of Otago, and then spent some time inpatient nursing and then travelled to Australia.
I think Australia needs more mental health nurses. We need to encourage all the young nurses that are joining the profession, give them branch exposure, allow them to come and do more clinical placements in mental health settings so they can see what it is, what it entails, and then they can make an informed decision to become a mental health nurse.
You have just this massive opportunity to impact people, and I think that's really, really exciting.
If you ask a person on the street, what does a nurse do? They wouldn't describe anything that a mental health nurse does because it's such a different, unique role.
All of those wonderful attributes that nurses have wherever we are really come to the forefront in mental health.
Thanks for sorting that, Marty. It says more or less all that video. It is just such a extraordinary career to have. Choosing a career in mental health, you obviously get increasing knowledge and your understanding of your mental health. You gain lots of experience of caring for people with lived experience of mental health. We use collaborative care planning and recovery focused care. You develop so many different skills, looking at caring for people with different and so diverse range of conditions. It's so challenging, yet it is so rewarding when you can help somebody. My colleague would agree that. Yeah. And you're constantly learning new things. It doesn't matter whether you've only been in nursing for 2 weeks or 20 years. There is always something new to learn. It is just such a satisfying job. Okay. So again, you learn different communication and interpersonal skills. If you're shy, it's maybe not the career to come into, but if you want to come out of your shell, mental health nursing makes you. You can't be quiet when you're trying to help somebody that's really unwell mentally. You learn to become more resilient. You have to be. Compassion, empathy. You learn better teamwork skills and different working with so many different multidisciplinary teams, from social workers to consultant psychiatrists. You have to be very, very adaptive and react quick to the situations. And oh my gosh, your self-confidence, it just grows so much. And yes, you have to be great at problem solving, critical thinking, but you also have to think out of the box, especially in mental health. Self-awareness, yeah, you need to be very self-aware. And hopefully the mental health will help develop the skills that you already have, communication, because you have to communicate with all sorts of different types of people, not just your team members, but your clients, your colleagues, your family, their family and friends. It's just a great career. Okay. Next. Yep. So mental health, we look at a holistic care because physical and mental health are, as I've said, are linked, and we use all of our skills to assist us in helping these people, and quite often they are quite unique, the skills that we have. We're looking at comprehensive nursing. Yeah.
I may just add, as Liz was just saying, this is a fantastic opportunity for you with comprehensive nursing backgrounds to come and consolidate those skills already known in a professional workspace, but then add on to it with your mental health skills. So this is why Liz and I say it's completely rewarding. It doesn't mean that you forget about those comprehensive general nursing skills that you've learned. You certainly bring them into the workspace. And as we've already identified, the poorer health outcomes for those living with mental illness, there's a real difference that you're able to make by bringing those skills into the workforce.
Yep. And so the next slide shows it is a fantastic career to have. We are highly valued and respected. As we've said, the demand for mental health services, especially nurses, is increasing so much. Secure employment opportunities, and there's so many different pathways that you can go to. We'll talk about that. As I say, it is a brilliant career to come into. Yep. And this is my pathway, as I say. As you can tell from my wonderful accent, we're from UK initially. I did my general training, then I've converted to mental health. And as you can see from the chart, I have done all sorts. I've been in older adult, acute adult, forensics, case managers in community, duty clinicians, staff development nurse, and now I'm a transition to program coordinator. It has also got me to Australia being a nurse, and it's got me traveling around Australia as well. And it is just so many different types of opportunity for you. It is absolutely brilliant, and I love it. And you will too. So we really want you in mental health, okay? So we're going to do a very brief overview of the transition to practice programs. The different areas are going to give you more information, but we're just going to do a brief one. So in Western Australia, you've got lots of places that you can work, as you can see. And we will tell you briefly about the transition to practice program. We do at North Metro, East Metro, South Metro, and WACS. Okay. They will give you, the individual services will give you much more information, and I think they already have some of them. So in the North Metro Health Service, it is a huge catchment area. We care for young adults, youth, adults, older adults.
Our services are delivered through inpatient units, community health clinics, day therapy, outreach programs. We've also got statewide and tertiary mental health services, including research, forensic neurosciences, art therapy, eating disorders, and other specialised services. But North Metro Mental Health, the Transition to Practice program, they'll go through more of their program in detail with you. We're just giving you a brief overview, some of the mental health programs available throughout WA.
Okay, so it's a bit blurry. Hope it's going to clear up a bit so you can see. So the next one is the East Metro catchment area, and they look at, they've got the Armadale and Kalamunda Hospital, and they you have the transition to practice program. They have inpatient community assessment and treatment for moderate to severe mental health. I'm sorry about this. It's just a bit blurry. So yes, they have the problem ranging again from older adult to acute, and the outpatient and community. And they have the Mead Centre and Eudoria Street along with Jacaranda House. So the Royal Perth Bentley Group, they also have a transition to practice program. Sorry, I'm babbling here. they employ both RNs and ENs, and they again, sorry, can we just go down a little bit? Sorry. So they have different rotations. They've got community, they've got one Grunkartup mental health, youth community. They've also got inpatient and ICLS transition programs, and the active recovery team, which is it's a we're running out of time, so we'll move on very quickly. South Metro, again, they are in the southern west and south west, southern wheat belt and goldfields, and they can care for adolescents, adults, and seniors in various different settings. And then there we are. They have eating disorder as well, and youth hospital in the home, which is a great service. And moving on again, sorry, this is quick, we need to finish off. Then we have the WA Country Health Service, which has brilliant opportunities for in the wheat belt area. They've got lots of different district hospitals, and there's lots of Aboriginal support up there as well. So for you to come in and do these programs, you've got so much fantastic choice. It's just absolutely brilliant. You spoke for choice, so yeah. So please think about mental health nursing and graduate transition programs. It's fantastic. So thank you. Sorry I babbled a bit. If there's any questions, we're around, and thank you.
Thanks so much, Liz and Dominique. There is one question that's popped into the chat. There was a query about whether there is a grad program available that combines mental health and general nursing.
So I can speak to that. Thank you, Mel. We used to have, and I think this is what they're referring to as the collaborative graduate program, where you could hop on Grad Connect and you could choose to do, at the present time, at that time it was an 18-month program. We did 2 6-month rotations in general medical surgical, and then did 6 months in mental health. That program was stopped, I believe, a year ago or 2 years ago, but we're actually we're having a meeting next week about re-establishing the program, but it'll probably be just a 12-month program. We spend 6 months either medical surgical and then 6 months in a mental health placement. So currently not on offer, but as soon as we get any updates to that, we'll obviously be able to let everyone know and update the various websites and information sheets. So it won't be in this Grad Connect round. That's all.
Thank you.
Thanks.
And then someone else has asked where they can see all of the mental health programs together. And I believe that they are listed in the Grad Connect handbook.
Correct.
That will be published at the end of the year. Is that correct?
Unfortunately, no one will be able to click on one link to go to one place to see all the programs. Each of the area programs are, sort of listed separately. But as you said, there is a place on the Grad Connect where they've got all those information to the transition to practice mental health programs.
Thank you. I'm just checking if there's any other questions for you. I don't think there's any new coming up. So thank you very much, Liz and Dominique, for your presentation, and lots of interesting information in there. So thanks for sharing.
Thank you.